a lot of therapists ignoring the pectoralis muscles, but it's really important for people who are sitting at the desk, especially right now. We're all in the phones, we're all moving forward, and this energy is go forward. So this muscle has become tight. This whole fascia is like a pulling down, and we don't want that because we start losing our thoracic mobility. If we look at the spine right now, if we are always hitting forward too much, so the spine is start bending this way, the muscles in the front become really tight, they open that spine facet, and we lose the mobility in thoracic area. The thoracic mobility is really important for our body, especially breathing is happening here, everything is here, so it's important. Most people try to mobilize the lower back, but lower back being created for stability, for the power. And as you can see, the vertebra has been designed to hold those vertebrae in a one position and not do a lot of rotation. So it's only 30 degrees in the lumbar area rotation. Here, we have to make sure we mobilize it. And if we, like I said, lean forward, those facets is open and it's pushed too much pressure on those nerves, feel a lot of pain. You don't want that. So what we're going to do, we're going to do pectoralis work today. And like I said, it's really important and we never ignore that part. So how I see if the pectoralis is tight. Usually I do test when person is standing. Now what I'm seeing, the distance between your posterior shoulder part and the table have to be inch and a half. What I'm seeing here is probably like a 2 inches, 2.5 inches. And if I look at this side, it's actually the same. So this is what telling me the shoulder is a little bit pronated forward, and I would like to work on this pecs and drop him down a little bit. Now, next one, I want to see the clavicle joints right in here. This is manubrium. We find a manubrium. We place 2 fingers on manubrium and 2 fingers on the clavicle. And what I'm doing, I'm just lifted up and down. So this direction and down, and see if any movements between manubrium and clavicle. Yes, I feel it's nice shifting. Don't go hard, don't do pushing too hard. And now I push it down and up. I see nice springing, everything responsible is good. So, and I see, yeah, up and down here, very good. Actually, and yeah, this is good now. Yeah, before we're done and it wasn't moving, now it's moving, it's perfect. So the next thing, I just want to check the shoulder. Simple test. I bring it, the shoulder to 90 degrees here, and I just drop it down to the table to see if any pain presence, if any. Good, I feel a little restrictions up here, and now I try to drop down. Internal, external rotation of the shoulder. This one is great. We already tested the left one, but for the training purpose and for the camera purpose, we're going to tread the right side. So what I'm doing, usually bring to 120 degrees if this is possible. Sometimes people have this rotator cuff, shoulder impingement. You can just bring to the 90. The idea is to teach the customer to rotate the whole shoulder in and out. In and out. So some people do just work on that forearm. They don't move the whole shoulder, but you have to teach them how to move the whole shoulder. So we're going to bring to the 120 degrees. Are you okay with that? You don't feel any pain? Always communicate with your client. Now I use the soft tissue of my forearm. I never use my elbow. That's why the most people they don't like massages or complain because some massage therapists use the elbow. We don't use the elbow. You don't use your elbow on muscles, directly on the muscles, directly, especially on the rib cage. So we use the forearm, soft tissue, fascia. As you can see, I don't apply any oil. So what I'm doing, I'm going to place my hand right in here. And you see, I hook him so I can move. You see, he's stuck. If I put the oil, it's not going to happen. I'm just going to slide off. You don't want that. We want this. This is why the difference between aesthetic massage, like Swedish, it's look nice, it's look great. People, I mean, love it. Nothing against that. But the medical, so you work with the fascia and you want to release that. So now I hook, and what I'm doing with every breath, he breathing, And when he's breathed out, I start pulling this way, okay? I can rotate my arm. He keep breathing. When he's breathed in, I light up, I relax. And when he's breathed out, I keep pushing laterally from the midline, okay? Couple times. I'm gonna take my beats. And yeah, how do you feel?
Feels good.
It feels good. So I don't push on clavicle, I'm just working those pectoralis muscles. Pulling out. And as you can see, my arm is rotate. You see, in and I pull a little bit more. You see this? I'm rotating my arm, and when he's out, I'm pulling out. Now, after like maybe 4 or 5 times, when you feel it's a little bit softening, like get more range of motion, now you're gonna ask David, rotate his arm in, and what I'm doing, I'm helping him out. You see, yes, and hold it, and I ask you to breathe. Always follow the breath. That's why the medical massage have to be slow. Yes, you can do a little bit of rotation. How's it feel?
Good.
Good. Excellent. So rotate in and rotate out. You can hold it up there. You apply a good amount of pressure, like 20 pounds. If any pain, if this is woman, just be careful, just drape it nice. You don't go lower. You just work on that superior pecs part. And you don't push against the acromial process because it's going to be really painful. Acromial too, don't go so high. You just stay right in this mean line, okay? Yeah, you can keep doing that. You can also work on the both side, which is you can use your forearm. Let me just show this way. So you can come up here, make sure you're not lean on the person, and I mean, some people lean with the stomach. Make sure it's a space and you're not going to choke your person. So now same thing, you're going to use your both forearm, you lean like that, and you work both sides, you see, this way. So your hands is like an X. And what you're doing, you're asked to do the same thing. Rotate with both arms. How's that feel, David?
Good.
This is really powerful technique, and you work both sides at the same time. And it's easy for you to keep that force away. You know, like slide off. Make sure you're not on his face. There we go. And this is how you do it. But I highly recommend start to work with one side.
Can you do with the fingers and the...
Okay, we have a questions. Can you work with the fingers? Yeah. Knuckles.
Just this little, you know.
For the woman?
Yeah.
Yeah, try it. Let's see. Let's see. Let's see.
Like
Come up here. Let's see. That's why you practice. So cross your fingers. Cross your arms, sorry, right here. So you good? Yeah, what's so funny? You think you think your boobs is gonna come on his face? You're gonna be all right.
No, it's weird, you know.
We okay. If this is feel weird for you, like I said, don't do it. But you can sit and do one side.
So that's why I say, can you do like this?
Yeah, it's one variation. But if this is a strong guy with a big pecs, I mean, you're not gonna help him a lot. You want to use one forearm,
Okay,
one side, yeah, one by one. Like I said, whatever you feel, it depends on the customer. Depends on what type of like person. Is that the big person? Is that the small person? Is that a lot of problems? If some bodybuilders come with this huge pecs, you not be able to do that. But your forearm, this is great because you feel your fascia and you also release your fascia too. You see my fascia is moving too now. I like to hook that. You see, everything is hooked. Okay?
No oil.
No oil, yeah. No oil. Especially on the hair. If hairy people like, yeah, just stay there and he's gonna create the movements. You don't do anything. So he's doing it. He's activated. You see? And let's see just different. Let's drop And see, if you measure it, you can see the difference already. Okay, the next one, I want to work on those pecs, and what I'm doing, let me get the camera close. So what I want to do, we already work from the top. Now I want to do the sandwich. I call this sandwich. So it's a tuning fork. I'm nicely come up, yeah, pec minor. I just come up here and I grab this pec minor. And I hold it. I'm not doing anything. I'm just asking David start do rotation. Whatever he do, like let's say bench pressing, everything what's activate those pecs muscles. Some lifting up. He grabs something like, I don't know, from the shelf. I don't know, play piano, everything. So I'm holding, I can hold it with one arm, with two. So go ahead and just do it. What I'm doing, I'm just hold it. How's that feel?
That's good.
Feel good. This is all I do. I'm holding it. Yeah, all different variations. Perfect. And what I can do, I can help him out. I can follow him and pull that muscle. And his direction, right there. How's it feel?
It's like it's loosening up.
Yes, it's actually feel really good for me. Like if you feel the difference between left and right, this is like a bit, and you can see it's dropping down. Next one, I want to just a little bit mobilize that shoulder. What I'm doing here, I want to work on that socket. You see, I'm holding his arm under my armpit, and I'm holding the shoulder right in here, and the humeral bone and shoulder right in here.
So you push it down.
Yeah, I push it down. I don't want that just be wobbly. So I get that, lock that scapula, and now it's, people ask, 90 degrees is fine for now. You can increase to 120. Let's see. And what I'm gonna do, you see, I'm using my body weight. See, I'm leaning with my body. See what I'm doing? I'm stick that bone, the humeral bone inside the socket, and I just hold it around 30 seconds, but we're not gonna hold 30 seconds. And I'm start rotate it. Now I'm rotate that humeral bone. And I pull. And you see this, why I'm holding it? I don't want this, the scapula and pecs moving. I want only humeral bones is mobilized, that shoulder. So that's what we're doing here.
It's good for frozen shoulders.
It's great for frozen shoulders. Great technique. It's sometimes you have to be really gently. If like couple, I have a rotator cuff problem, people. It took me 3 sessions, just hold it there, and after the 3rd session, I can start move. The first session was really painful for a person. Don't put the person in pain. Yes, never put your clients in pain. Most people thinking, like I said, they feel pain, they think it's beneficial for them, but this is not. It means something not functioning, something not working. You might have arthritis, you might have inflammation, and that's not really beneficial. Let me show on this side. Same thing, 90 degrees. Come up here, lock it in, grab that humeral bone a little bit lower, close to the elbow. Stick the humeral bone. Wait for 30 seconds. There we go. That's amazing. Rotate up and down. Now I can release it and move that shoulder together, the whole piece all together. Humeral, shoulder, scapula. Just see how's everything. Does that feel okay? Great. All right, now Marina is going to work on the shoulder. And look at this different. Look at that, how the shoulder is dropped down. We just work 5 minutes on the pecs. It's already looking good. Yep, so bring to 90 degrees. You see, try to straight up. Don't, there we go. So come up here, whatever you feel comfortable. So you can use this arm on the top, or you can use this arm on the top. Which one you feel better for? Yeah, it doesn't matter. Like if some, yeah.
The other one. I wanted the other.
All right, just
It's okay. No.
okay. So bring to the 90 degree. Bring to the 90. Don't bring up. So now you lock it in. Don't lift like lower down, straight. There we go. So use. Yeah, here we go. So this is the pressure down. Now you just use your body, lock this in like a jiu-jitsu guys, like a sambo. Just hold it in. Just hold it in. Learn how to hold first. Yeah, distraction, like a little bit, yeah. And now you add a little bit of rotation, but use your body. Look what I'm doing. Let me grab other stuff. Let's tear David apart.
At the beginning for 30 seconds.
Watch.
Before he rotated.
Yeah. So you see, the arm is up here. It's not going anywhere. So you see,
right.
I'm just holding this humeral bone now. Now I place it down, and I'm lean. You see what I'm doing? I lean with my body. That's it. I'm lean. You see my body? I'm leaning forward. I'm leaning. I hold it. That's it. Now I pull with my body. I'm leaning in. I pull with my. It's good. I think I'm better. It feels good. Yeah, just like that. It's really good cross.
Is it the same?
Yeah. Just use your body. Don't you? Yeah. And now you add rotation. You see?
He starts without rotation and then.
Yeah, I add rotation later, because we don't know what's the, and it's tiny. It's micro. It's some people doing like it. This is too much. You just learn, and this is my movements. You see? It just a slightly. It looks like a big rotation, but it's not, because I'm moving biceps too. I'm moving biceps, but the bone, the humeral bone, yeah. And you just pull in, okay, and pull. It's look really good. Sticking it.
You hold for 30 seconds.
Yeah.
You rotate after you hold for 30 seconds. And then you do the rotation.
Yes, but they look really good.
But
Look at that shoulder mobility. This is amazing job. And I believe, this is the beauty of massage. When you feel the benefits of massage, you feel good for a couple days. It's still good, but when you feel relief, when you feel it's something being done for your shoulder, that's the beauty of this. Okay, so.